Okay, welcome to the 26th annual meeting of the Friends of the Brookline Public Health. And so thank you all for coming. Feel free to grab a snack and more drinks, especially if I'm talking, because you don't want to miss the great program that's up ahead. But first, I wanted to thank everyone here for putting this all together. In particular, Lynn, Cheryl, Pat, Segal, Darlene, and folks here, and Brookline Interactive for filming this. Thank you so much to our Brookline Public Health family, because we wouldn't be here without you. So thank you. Yay. I like clapping. And I also definitely need to recognize Segal Reese, our public health director. Please stand up, turn around in your gloriousness. As also a Brookline resident, I am so thankful that you are here and our public health director. Truly thankful for me, my family, friends, and our community. So a few housekeeping. Where's the bathroom? Anyone? Right there. The most important piece of information, right? Feel free anytime you need to, it's right there. Also, I just want to let you know how this evening's going to run. So I'll talk for just a minute longer probably, and then we'll have a brief Friends of the Public Health financial report. They'll have a meeting, and then we're going to get to honor 4 amazing folks for the work that they'll do. And then we'll still get to have even more, and we'll have Carrie Beth Goldberg, who will then moderate an amazing panel on artificial intelligence, AI, which I'm excited about because I will be honest, I don't really know much other than I've been using it online to make graphics of my dogs because they're so cute, and that's just literally all I've done with it. So I'm excited. I hope you'll enjoy this program. And I'm Chris Chania-Sulkett, so if you need anything, just holler out, Chris. Again, the bathroom's over there. Feel free to get more snacks. So I just finished serving as president of the American Public Health Association, and I loved every minute of it. So if you can, feel free to give a membership to APHA. It's the holidays. You don't need any gift wrapping, apha.org. But now I get to be back here with my Brookline Public Health family, where it all started and where I just really feel at home with, so thank you. So first, I wanted to take a moment to remember Dr. Blake Cady, who is a Brookline Public Health hero. So for any folks who knew, he died earlier this year, and he was an amazing and inspirational surgeon and oncologist, and he was a visionary who was really passionate about prevention, and prevention is public health, right? And he promoted, of course, in Brookline, non-smoking policies, and he revolutionized our tobacco control, which we're quite known for here in Brookline. So a moment for him, thank you. Now, I think probably perhaps my second most important job, besides telling you the bathroom and timing, is that this is the Friends anniversary. And we are hoping, as the Friends of the Brookline Public Health, to raise $10,000. So you know what I'm gonna do. I'm gonna ask you for money. Let's make it rain, right? Okay, so honestly, if you don't know it, you should know that only 0.3% of our town's budget goes to fund the Brookline Public Health Department. 0.3%. That's not even 1% of our town's budget, right? So the Friends of the Brookline Public Health come in, and with all of their amazing work, they fund a lot of grassroots community organizations and provide opportunities to really improve the health and well-being of people in Brookline. And so if you can give, it's the season of giving, please give to the Friends of Brookline Public Health. There's actually a lot of evidence-based research that shows that when you give, you're happier. So anyone feeling a little down in the dumps? Let's give. Give in honor of other people. It makes the best presents, no gift wrapping necessary. We don't want to add more clutter. So please give to the Friends of the Brookline Public Health. They do amazing work, as you'll soon see with the awards that they're honoring. And you can also give if you look at the back of your amazing program. There's a QR code that you can scan. So please do that. Or if you want, feel free to talk to any of us at the Friends of Public Health. We'll take your money in all forms, all the time. So anyhow, I wanted to now introduce the president of the Friends of Brookline Public Health, Richard Segan. Welcome.
Thank you, Chris, and how wonderful it is to have the immediate past president of APHA in Brookline. Chris, for those of you who don't know, is very generous of her time. Even when she was traveling around the country, she was very generous of her time for us. So thank you, Chris, and thank you for being here tonight. By way of correction, I'm not the president, I'm the co-president, and I'm going to introduce the co-president with me momentarily. So thank you all for joining us. I wanted to just give a very brief recap of a few different things. First of all, the Friends co-sponsored 3 public health educational programs this past year in collaboration with the Health Department and community partners. The first was on PFAS, another was on reproductive health, and the third was on planning for a healthy winter, including about vaccine hesitancy, which is a very relevant issue at this time of year. From a financial standpoint, thank you, Chris, for the pitch. You may have heard that we established a dedicated fund for the Friends of Brookline Public Health at the Brookline Community Foundation, which means that all donations to the Friends through the Brookline Community Foundation are tax deductible. We now have a balance as of this evening of about $5,300, or to be precise, $5,396 in our dedicated fund. And there have been many different requests or suggestions for use of these limited funds. We made 3 grants so far this year. The first was we supported the Brookline Housing Authority's Community Day with a grant of $500 to promote the BHA's Health Department's Farmers Coupon Program for BHA residents. Secondly, we donated $510 from medical equipment at the health center for the health center in Brookline's sister city, Ketsawaake. And third, in a grant of $1,000 to Women Thriving, we're supporting women participating in their Wellness Ambassadors program at the BHA. Additionally, $6,000 was raised by the Friends of Brookline Public Health food pantry team that participated in the Walk for Hunger. And $3,600 of those funds went to Brookline Thrives. And in Brookline, $2,400 went to Brookline Project Bread. So as Chris mentioned, there's a QR code that you can use, and information about donating to the Friends and your contributions at any level will be appreciated and will help us expand our work. And now I'm going to turn the program over to Chris, or over to the Chris. Okay.
I get to pop back and forth. Thank you, Richard. I'm so sorry. He's the co-president. Maybe I need new glasses. Okay, so next, I get to introduce 2 trustees, Pat Marr and Cheryl Leffman. They are both longtime and amazing leaders with the Friends of Brookline Public Health, and they do so much for us as a town. And in particular, I also have to say they've done a lot as we have been in the thick of the pandemic and as we try to get out of this. And then also on a personal note, I just really like Cheryl, and I got to spend a lot of time with her over many, many years. So please welcome them up so that they can do what I think is quite possibly one of the most fun parts of tonight, which is to honor those who do good work for us here in town.
Okay, welcome everybody, and thank you for coming. Just to solve the mystery, I am the co-president of Friends of Brookline Public Health.
I'm never going to get hired to do this again.
Cheryl and I are going to announce the awards today, and I will start. One of the most important traditions of Friends is recognizing the amazing individuals and organizations in town that have made such significant impacts in public health. This year, we're looking backwards and thinking about and recognizing those who really helped us get through the COVID years, and recognizing those who were essential to our community during that pandemic. So I'll start with the first award this evening, and that is the Alan Balsam Public Health Leadership Award. That was named in 2016 to honor the former public health director that I'm sure many people here remember, Alan Balsam. And it has been awarded since 1999 by the Friends to an individual or group that has shown extraordinary leadership in the field of public health, locally and nationally. So we're giving 2 awards this year to make up for some lost time in the pandemic. And I would like to begin. We are pleased to honor Dr. Larry Madoff as a recipient of the 2023 Alan Balsam Public Health Leadership Award. You must know a lot of people. No, I have some things to say. Dr. Madoff is Medical Director of the Massachusetts Department of Public Health, Bureau of Infectious Disease and Laboratory Sciences. And he's a professor of medicine at the UMass Chan School of Medicine. Dr. Madoff's work focuses on the epidemiology of emerging infectious pathogens and international health. For nearly 20 years, he served as the editor of ProMed Mail, which is a groundbreaking internet-based community platform for detecting and reporting emerging disease outbreaks, including the earliest public reporting of the global SARS outbreak in 2003. As a key state leader in infectious disease epidemiology and health policy, Dr. Madoff played a pivotal role in navigating the COVID-19 epidemic in Massachusetts. But luckily for us, Larry is a longtime Brookline resident, and notwithstanding his significant international, national, and statewide commitments, whenever there is a need in Brookline, he always answers the phone for us and offers his time and expertise, for which we're very grateful. He is a past president of the Friends of Brookline Public Health and now a trustee, and has continued to offer his steadfast support, his good humor, his invaluable knowledge, and the efforts of Friends and the Brookline Department of Public Health. So it's my great pleasure to recognize and celebrate Dr. Madoff's many contributions to public health with the 2023 Alan Balsam Public Health Leadership Award. Congratulations, Larry. If you'd like to say something, I'm sure everybody would.
Thank you.
Oh, congratulations.
Thank you. This is really quite an honor. It's an honor to be recognized by your neighbors. It's an honor to be recognized for basically doing my job, which is what this amounts to. And it's an honor to get an award named for Alan Balsam, who was such a great leader in Brookline for so many years, and I really appreciate it. I will thank my wife, Nancy, who's here tonight, my family for putting up with me during the years of the pandemic and for all the other ridiculous nature of my work over the years. And also thank the Friends of Brookline Public Health, so thank you.
Now we'll take pictures.
Thank you.
I have the honor of awarding the second 2023 Alan Balsam Public Health Leadership Award. Tonight, we salute the work of the staff of the amazing Brookline Department of Public Health and Human Services during their work during COVID-19. Here are just a few examples of what occurred at the health department during the COVID-19 pandemic. 70,000 COVID-19 home antigen test kits were distributed, including to every apartment at Brookline Housing Authority. 62 COVID-19 vaccine clinics were conducted since January 2022. And thousands of calls were placed to the Medical Reserve Corps call center and the health department for information, isolation and quarantine guidance, and vaccination information. The staff's unwavering commitment and tireless efforts, countless hours, and dedication to safeguarding the health and well-being of Brookline was nothing short of exemplary. The support provided by the staff in implementing crucial public health measures, disseminating vital information, including contact tracing and conducting testing and vaccination drives, and offering guidance to residents, was invaluable in navigating the pandemic. Their collective efforts were instrumental in mitigating the spread of the virus and fostering a sense of solidarity and resilience within our community. The Friends of Brookline Public Health extend their admiration and gratitude to each member of the Brookline Department of Public Health and Human Services for their exceptional service, unwavering commitment, and selfless dedication during those challenging times. Congratulations, Department of Public Health and Human Services, on earning the 2023 Alan Balsam Public Health Leadership Award. Could we have the staff of the Health Department stand? And woo-hoo! And accepting the award is Sigal Reese, the director of the Brookline Health Department. Would you like to say anything? I can hold your award if you want to.
No, I'll hold it.
Oh, absolutely. You think that works better?
So, of course, thank you to the Friends. I get the privilege to come up here, but really the people that stood up, glad we could applause them because they're the ones that really did the hard work and continue to do the hard work in our department. So really want to thank the staff of the Brookline Public Health and Human Services Department. It's an amazing team, and it's a privilege to be able to work with them and lead them in this amazing community. So thank you again to the Friends.
Thank you.
Stand in the middle. Stand in the middle.
Thanks, Sigal. The next award given by the Friends is the Herb Carlin Community Health Award. This award has been given since the year 2000 to an organization or individual who has made an outstanding contribution to public health in Brookline. It's my distinct privilege to recognize Bonnie Bastian, whose dedication and commitment have left an indelible mark in our community. In the face of unprecedented challenges as the COVID-19 pandemic began, Bonnie emerged as a beacon of hope and action. On March 15, 2020, just 2 days after the closure of Brookline schools, Bonnie co-founded Mutual Aid Brookline. This initiative was born out of a deep concern for unmet critical needs within our town and a resolute determination to provide immediate assistance. Bonnie's leadership enabled Mutual Aid Brookline to swiftly respond, and as a result, the impact was far-reaching and profound. Close to 300 volunteers worked thousands of hours and made 1,900 deliveries of groceries and supplies. These supplies were subsidized with $140,000 from small individual monetary contributions. Child care subsidies were made for 7 Brookline families. Direct financial aid of more than $20,000 from donations of community members, and $16,000 in unrestricted funds from a Brookline Community Foundation grant were disbursed. Bonnie's tireless efforts to continue to reverberate in Brookline. Her current work with the Brookline Community Development Corporation, her role as a town meeting member, and her active involvement with Brookline for Racial Justice and Equity stand as testaments to her dedication to foster a community that thrives on equity, justice, and compassion. Bonnie's ability to inspire people to come together in times of need has been a remarkable contribution to our community's health and well-being. Congratulations, and it's my privilege to honor Bonnie Bastian on receiving the Herb Carlin Community Health Award.
Hey everybody, thank you. This is very much an honor. My name is often the one name associated with Mutual Aid Brookline, but it was not me, and Mutual Aid Brookline was not mine. I may have been the impetus in the beginning, but Mutual Aid Brookline existed because of those hundreds of volunteers coming together to organize each other and do what needed to be done. Mutual aid work is about real community building. It's about seeing your neighbors, not watching them. This is how we create true public safety, how we create abundance in community, and this is how we will survive our future. I think it's important to point out that the people that we served were not all poor people. COVID hopped many of those class boundaries. A portion of the people in need of assistance were people with plenty of means, but no community. In the beginning, you couldn't pay someone to deliver your food. That wasn't happening yet. So that moment revealed just how critical community is to survival. Love and caring are our currency, but somehow the world we live in wasn't built to allow love and kindness and the resources we all need to survive to flow freely. We need to be brave and bold enough to perceive the barriers, realize that if we invented those barriers, we can also knock them down. I know we're capable of it because I've seen it. So thank you very much on behalf of Mutual Aid Brookline.
Okay, thanks, Bonnie. So I have the privilege of awarding the second 2023 Herb Carlin Community Health Award to Brookline Thrives, which is a part of Brookline Food Pantry. Brookline Thrives is a weekend food program that directly benefits more than 400 school children in the Brookline's K-8 public schools and the BEAT program as well. It offers convenient, free weekend meal backpacks to local families. And this allows families to have additional food options for over the weekend for their children. No proof of financial need is required, and families and children pick up the backpacks on Fridays. All kids in the household can get a backpack. The program was created by Kim Kushner in 2018, and it's not just about providing meals. It's about addressing the reality of food insecurity that affects many Brookline families. The impact of the program extends far beyond the food in those backpacks. It nurtures the academic performance and well-being of our students, allowing them to flourish without the burden of hunger. Brookline Thrives is supported by a dedicated group of volunteers who have packed 54,500 weekend meal backpacks since its inception in 2018. And behind these numbers lies a commitment to ensuring that no child in the community goes to bed hungry. So we honor the entire team behind Brookline Thrives and acknowledge the families, the volunteers, the donors, the food pantry, everyone involved in making this program a resounding success. It's my privilege to present the 2023 Herb Carlin Community Health Award to Brookline Thrives. And Sharon Brockman, who is now the manager, will accept the
Hi everybody, I'm Sharon Brockman and I am the Brookline project manager for Brookline Thrives. I've only been in the job for a year now, so really I'm only here to say thank you so much. It's a great honor. There are 60 plus volunteers every week who backpack, who deliver the bags into the schools, as you say, to all K-8 schools, to the Brookline Early Education programs. We have 2 community pickup sites every Friday at 5 p.m. and it's just a wonderful program to work with. So thank you.
Oh, thank you.
Thank you.
Thank you so much, Cheryl Leffman, trustee and co-president of Friends of Brookline Public Health, Pat Marr. Thank you. So just really quickly, because I'm moderating and I'm going to go off script, is I have to say that I've been spending the past year traveling all across the nation, from very small cities to larger cities and towns throughout the nation, truly visiting and meeting with their communities. And whether I've been to Boise or Bismarck or Anchorage, where I met a moose, I am so thankful to always come home to Brookline for so much of what you just heard. This is really a place where there is community. It's not perfect. I've been in town meeting. It's not perfect. There is room for improvement, but it's an incredible place and a space filled with people who care. And you heard it through the words that were given. We make sure that no child goes home on the weekends hungry. We make sure that when people don't have this community, we're gonna give you community, whether you like it or not, right? So just remember that. Times are tough. There's a lot of work that we have to do, and we still have to do it. But goodness, we're starting from a really great place. And part of that is because of our health department, and obviously because of the Friends of the Brookline Public Health. They're there trying to meet all of those critical needs. And I just have to say, I'm so thankful to be a part of this community. So you all are amazing. You're all here as well. So those who are here, you should also get an award too, because it's cold out there. I know it's just kidding. I just came back from Florida and why is it so cold here? But you're here, so thank you. Give a round of applause again for our 4 winners, please. So now I get to turn it over to Carrie Beth Goldberg. I'm not gonna read the bio because you have that in this awesome program. Now, she's pretty rock star. You've probably heard her on the news, Bloomberg, WBUR. She's written a number of books. She's gone to every amazing university that I've never gotten into. Graduated summa cum laude from Yale. Oh my God. So she went everywhere. Oh, but it did say she dropped out of graduate school at Harvard. Oh, but that was just to go to Russia. Probably to be the Moscow correspondent for the LA Times and the AP. Oh my God. Slackers in Brookline, I swear. So no, I'm gonna introduce Carrie Beth Goldberg. She's gonna introduce her amazing panel. They're gonna talk to us all about artificial intelligence. I'm excited because I really don't know much about it. And what I think is really amazing about her is she's able to explain and get people to explain things in a way that I can understand it. So welcome, Carrie Beth.
So I'd like to invite up the panelists. I'd like to tell you the main thing that I learned while we were planning our panel and chit-chatting, which is that John Brownstein, who has long been a great disease tracker with all kinds of high-tech methods, was asked by Zach Kahanu, what the heck's going on in China? And he said, nah, it's just what we went through last year. So that was very comforting. I don't know, Larry, if you want to contradict that, but anyway. Chris, thank you so much, and we are so lucky and honored to have you here. So yes, we were talking about AI, and I thought the best way to start, is the sound okay? Everything's good? Would be, actually, let's have a show of hands. How many people have played with ChatGPT or GPT-4? Oh, good. Okay, so about half, maybe a little more. So of course, preparing for this panel, I did what we're all going to be doing, I'm sorry, from now on, which is that, of course, I asked GPT-4 what we should say, what we should talk about. So here's my prompt or my question to GPT-4, which, by the way, I got to just by using the Microsoft search engine Bing, which has GPT-4 embedded in it, this new AI. So I said, hello, GPT-4. My name's Carrie Goldberg. I've been asked to moderate a panel in my town, Brookline, Mass, about how generative AI, like you, could affect public health. Could you please write me an introductory speech of about 2 minutes? So it started saying, so here's what it gave me in 30 seconds. Hello, everyone. My name's Carrie Goldberg, and I'm delighted to be the moderator of this panel on how generative AI could affect public health. Generative AI is a branch of artificial intelligence that can create new content, such as text, images, music, or code, based on some input or prompt. For example, I just asked Bing, the new AI-powered chat mode of Microsoft Bing, to write me this speech, and here we are. So it has humor, actually, somehow. Yes, I know. And so I asked it about Brookline specifically, and it mentioned that the town has adopted a health equity action plan that outlines its goals. So I asked the chatbot, how could AI help with Brookline's health equity action plan? And it said AI could help in a few ways. For example, it could engage with diverse communities by creating culturally and linguistically appropriate chatbots, voice assistants, or text messages that can provide health information. It could help enhance data collection. It could help increase access to healthcare and social services by using image recognition, speech recognition, natural language generation to create accessible and affordable tools for screening, diagnosis, et cetera. So then I said, okay, well, what would pose the greatest risk specifically for Brookline? Talked about privacy, security, bias, discrimination. It could undermine the trust and accountability of Brookline residents by making decisions that are opaque, unexplainable, or unpredictable. It could disrupt the culture and identity of Brookline residents. And then one last question, I asked it, okay, so what could be Brookline's first project using AI for public health? And this, I think, to me, is the most amazing part of this level of artificial intelligence, which is that it's actually being creative in what we hear next. So it said, well, Brookline's first project using AI for public health could be forecasting trends in opioid overdose mortality using heterogeneous data sources. So it could use AI to analyze various data sources like prescription records, emergency department visits, death certificates, social media posts to identify patterns, risk factors, and hotspots of opioid overdose deaths in Brookline that could help the town to design and implement effective prevention. The second idea it had was syndromic surveillance using large language models, which is what GPT-4 is, and spatiotemporal point processes. I have no idea what that is. John will explain it to you later. And he said, and it's it. It said this could use AI to monitor and detect potential outbreaks of infectious diseases such as COVID-19, influenza, or measles in Brookline. So you could use natural language processing to extract relevant information from online sources like news articles, social media posts, web searches, et cetera. This was my fantasy when my kids were in the Brookline Public Schools, that when there was flu rising in our school, boom, we would know it, instead of having to gossip with the other parents about who was getting sick, right? And one other idea it had was you could use natural language processing methods on foodborne outbreak data to identify potential outbreak sources. So, and then last question, I asked it, well, how about direct-to-consumer use of an AI chatbot like you? What could you do? And it said, well, certainly you could use me for health education and awareness. I mean, one of the most striking things is that these chatbots can instantly translate anything into most major languages. AI could also offer health support and coaching, could foster health engagement and empowerment, and then there are also the same risks as we said before. So I just wanted to start with that as an introduction, just to kind of set the table for where we are and what we're talking about, and what these incredible experts that we have here today will be addressing in their own talks. So first up is Dr. John Brownstein, who is the Chief Innovation Officer at Boston Children's Hospital, professor at Harvard Medical School, and most importantly, a Brookline dad.
Thank you. Let's see if this works. This is my first time at Brookline High. I'm actually touring it in like a week for my son, so this is good intro. Is it coming? What? He's behind the screen. Are you starting it or? Yep. Okay. Something's happening.
Yeah,
Okay.
now it's happening.
Okay, great. All right. Well, thank you so much. I'm really glad to be here. Excited to be on this panel. And a lot of my work actually at Boston Children's is focused on AI. It's focused on AI from the clinical side, where we're trying to bring in new methodologies to help our patients reduce burnout, create efficiencies in the way we deliver care. But my background as an infectious epidemiologist has been always to bring new technologies to the forefront when it comes to deploying and improving public health surveillance. I did want to mention a little bit of a background, because I think AI in the moment has taken shape, of course, with the advent of generative AI. But the reality is there is a very long continuum. And in fact, AI has been part of the fabric of public health for many years. And the ways, and I'll talk about a couple examples. Obviously, right now, the opportunities have transformed dramatically with the advent of generative AI. I do want to mention that oftentimes people think that AI is automation, and actually when we go around Boston Children's and say, oh, we're trying to bring AI, the examples they give are just, basically scraping text from one spreadsheet to another and merging files, and we realized it would take an hour of code just to improve their day-to-day tasks. So what's happened is this opportunity in generative AI has actually allowed people to think more creatively about how they do their jobs, even if the solution is not always about AI. But of course, we're thinking broadly within the hospital, but also within the deployment of public health technology and surveillance that we develop, all the ways in which we can help and support our staff, our patients, the ways in which we do work. And so there's much promise with these technologies in increasing efficiency, reducing burnout, the opportunities, and I know in public health, which is incredibly under-resourced, the opportunities to bring these technologies to the forefront, pretty significant. I would say that in public health, we're much slower, I would say, than on the clinical side. I'm seeing rapid transformation and adoption of these tools in the clinical settings. Not seeing necessarily that same level of adoption on the public health front. In fact, I got to write a paper for New England Journal of Medicine, thanks to Zach recently last year, and we actually did a literature search to understand where AI was being deployed in infectious disease surveillance. There is actually not that much in the published literature. If you look at the clinical side, and Zach is the editor of NEJM AI, there is an explosion of research. Public health, not so much. And in fact, Carrie, you mentioned the examples of using syndromic surveillance, collection of and harnessing of data, processing that information. That is actually one of the key areas where we can take mass amounts of quantity of data, process it, and make use of it for early detection, surveillance, response, understanding the interventions that we're deploying in communities. One of those examples is actually the earliest signs of COVID. One of those signals, another signal is ProMed, which my colleague Larry Madoff was part of. The idea that you could mine all the world's content and identify an early sign of a mysterious outbreak that was taking place in a part of China through mining news and social media. The first sort of report came from that local news source in December of 2019. And through that, we can actually build surveillance tools that actually, and I know the contrast here might not be as good, but mining all that information from social news, media, public reports, you can actually trace a virus as it spreads around the globe in real time through the organization of all that content. And then if you think about how you use that content for response, we think about the past year where we dealt with the triple-demic, and that was something very specific to pediatric organizations that were dealing with RSV, flu, COVID simultaneously. There was an opportunity to use external data, both data from public health surveillance, but also informal data sets to actually make predictions of what bed capacity might look like in the coming weeks. Obviously, one of the things at Boston Children's that we were trying to avoid was making sure that we were not eliminating elective procedures unnecessarily, and that we had the right capacity in mind as we were thinking about going through the season. And with machine learning and the aggregation of data and forecasting, we could predict to the day when things would turn on RSV, COVID, and flu, and support our ability to make sure that we are optimizing care. So that's a clear example of a use of AI. Now, of course, in this moment in time with the use of generative AI, it's unlocking a huge number of new applications. And so, for our perspective in our team at a research group, we think about the opportunities to mine information and to optimize public health response. I'm sure that you can think of, and we'll have a conversation about the dozens of applications that can be done. And Carrie, you mentioned communications. I mean, that's absolutely one of those examples where you can tune public health communications to the right context, the right language, right education level. And obviously there's many opportunities to track misinformation and to understand how rumors get spread across different sites. So We can talk, of course, in the discussion about all the applications. On the clinical ID side, the opportunities to document clinical encounters using AI to exchange emails with patients, to create discharge notes that are relevant to the patient. All of those things are actually being done currently on the clinical front right now. Now, of course, there is a challenge with all this, and I'm sure we'll talk about the biases, the inherent challenges of these data, the misinformation that these large language models can be trained on. That's definitely a concern that we have. Obviously, this hallucination concept where these large language models might produce false information, and then how those rumors might get spread across social media. So there are many challenges I'm sure that we'll talk about. And I'll just talk about one final example, which is, okay, if we have an analogy to the COVID vaccine. So vaccine was an incredibly safe and effective vaccine that was deployed across the population. Now, the expectation is if you have that kind of a tool to support the response to an infectious disease, that you'd have people lining up in joy and parades in the street. And of course, not exactly what happened if you think about half the population being sort of anti this vaccine. So imagine you have this incredible tool to respond, which most people here in public health get that. And in fact, we recognized how tenuous this intervention was. This is work that we did with the CDC to look at confidence in the various vaccines. And this was presented at the ACIP meeting, where essentially when the J&J vaccine was paused just for a safety event, and then it was unlifted, confidence in that vaccine dropped dramatically, and it never regained, the J&J vaccine never regained it. And that was this data was sort of good evidence to support to move away from the J&J vaccine, because people just didn't want it, even though it was still a good vaccine. So we did a survey of people across the US about whether they are interested in having AI be their physician, whether they're interested in primary care, or maybe you're interested, your psychiatrist, psychologist being an AI-driven therapy tool. There are actually surprisingly more people than we thought would be interested. 1 in 3 would use AI as part of their primary care. Challenge is, we have to think very clearly, because if this is, if the concern around vaccines that is incredibly effective, still we can't get people to accept it, what's going to happen when we have this AI safety event occur in a population? Because we've deployed these algorithms and we haven't thought about who we're leaving behind, what subpopulations these tools don't work for. There's going to be a huge backlash. So as much as our team is super excited and we're trying to bring AI to the bedside and to public health, we're also recognizing that we have to do things in a very safe and effective manner. Otherwise, we're going to lose this moment in time. So with that, I'll look forward to our conversation. Thank you.
Thank you, John. And you reminded me of the most important thing, which is this is a conversation, and as soon as everybody's done speaking their initial bit, I hope that you'll all have lots and lots of questions or comments for them. So next up, Dr. Isaac Kohani, the inaugural chair of the Department of Bioinformatics at Harvard Medical School, which he basically willed into existence, I would say. And he was my co-author and really the instigator of the book that we co-wrote, The AI Revolution in Medicine, GPT-4 and Beyond. Zach.
Thank you, Carrie. I cannot overemphasize how precious Carrie is to our community. She is really the voice of false science and healthcare science, and we have too few such people. And communication of science and healthcare, I think, is probably more important today for public health than pretty much any other activity. And so I am really grateful to have a colleague such as hers. Wow, I did not know I was going to start by brown-nosing. Anyway, so most people call me Zach. And I want to tell you that I grew up in Switzerland, in Geneva, Switzerland. And I spent my first 17 years there. And both my parents were from Eastern Europe. And so why do I have this American accent? Because I went to an international school, and the majority of, and all the other kids had American accents too, even though our teachers were British, because there was a small minority of American kids, and their accents was infectious, and we all got their accents. And so I came to my parents sent me to a English-speaking school because they wanted me to go into science, and I dutifully followed that. And then when I went to college, I decided I was going to go into medicine. And then when I ended up in medical school, in my first year, I said, "Oh my gosh, medicine is a wonderful calling. It's an art, but it's not really science." And I said, what did I do? And so I asked around, and Boston is, even back then, incredibly fertile in terms of connections. And I made it to a guy called Professor Peter Solovich, who's a professor at MIT, still is. And he was just then starting a new AI and medicine lab at MIT. So I did my PhD with him. So I bailed out of medical school for a few years, did my PhD, and that was on AI back in the 1980s. And then there was a lot of promise, and then it all collapsed because we overpromised then. And so because of some real important changes that have happened over the last 25 years, I'm actually very much more optimistic about what AI is going to do. And what are those changes? Just very briefly, the same, first of all, computing has changed. The same computer chips that our sweaty teenage boys used to kill aliens at 4K resolution at 60 frames per second, the graphic processing units, are these highly parallel, there's literally tens of thousands of processors on it. And that highly parallel computation allows you to do the kind of neural network computation that modern AI needs. The second thing that happened was that we got a lot of data. Back in the 1980s, we didn't have a lot of online data. Now we have terabytes of online data to train up these. And basically, almost anything that's ever been written is now online. And the third thing that happened was that the technology really moved forward. And there were some real breakthroughs in 2010s around image recognition. And the technology, it doesn't matter what the details are, it's called the transformer technology, was actually ironically developed by Google, employees at Google, in 2017. But then Google didn't really choose to make it into a product because that would have been competing with their main business, which is search. And so a group in OpenAI that eventually was invested in by Microsoft went for it and developed this project, these GPTs, the generative technologies, that back in 2020, I looked at it and said, what is this? It was very unimpressive. GPT-3 in 2021 was interesting, but looked like a toy. And then I get a call from the senior vice president of Microsoft telling me that the CEO of Microsoft has authorized him to speak to me. This is October of 2022, about this new product, which was codenamed DaVinci 3 back then, but ended up being GPT-4. This is even before ChatGPT. And he told me what it could do. And so trained as I forgot to tell you, I then finished my medical training and I became a pediatric endocrinologist at Children's Hospital. And then I created a department, and all my research has been basically in artificial intelligence. Anyway, so he calls me and he tells me about this project. And I went through all the stages in just a matter of minutes of grief and mourning, denial, anger, and eventually acceptance. And what I then did is I'm involved in a lot of different projects, including something called the Undiagnosed Disease Network. It involves 12 hospitals around the country, academic health centers, where children are evaluated and genome is sequenced, and we diagnose them when, after years, they're not diagnosed by others. And I gave GPT-4 one of those cases, that most of my colleagues will not be able to solve. And it solved it. I said, whoa. But that seemed still rather academic. But then in the news, I read about this mom. Her child had trouble walking, and then trouble chewing, and then was having headache pains, huge headaches. And they wouldn't go away. And she went to doctor after doctor. She got imaging study after imaging study of head CTs and so on. No answers. So she literally just typed in all those reports into GPT-4 and said, what does my son have? And GPT gave a list. And the top list was something called tethered cord syndrome, where your spinal cord gets trapped by your bones towards the back. She goes to a neurosurgeon with the already done, previously seen MRI and CT scans and say, is this tethered cord? He said, oh yeah, it's tethered cord. Think of what that means. We'll talk later about bias, hallucinations, and all that. Plenty to say to that. But I want you to consider the world that we really live in today. Mass General Brigham, the pride or joy or fear of big health in Boston, is not taking any primary care patients now. As a department chair at Harvard, I get new faculty coming from a small feeder school. What's it called? Oh yeah, Stanford. And they show up and they say, Zach, where do I get primary care? And I say, well, now I don't say this anymore, but I used to say, let me talk to my friends. And I couldn't find any. And I talked to Scott Podolsky, who had a very fancy private practice at MGH. And I said, Scott, what about seeing my faculty? He said, no, I'm closing down. I said, where can they be seen? Are there any good practices around? He said, no. And here we are in Boston, there are no practices. So no open, great practices. So what does that mean? It means either. So don't start talking to me about AI and health disparities. It means unless you're wealthy and can afford $5,000 a year for a concierge doctor, you're going to be waiting in long lines for maybe just average doctors. And in that context, you have to ask yourselves, how can we improve healthcare? And we're all, as evidenced by this room, getting grayer. And yet, the number of primary care doctors relative to the population and the need is dropping off. It's estimated in 10 years, we're missing around 40,000 primary care doctors. Already today, 25% of primary care in the United States is delivered by nurse practitioners and physician assistants. And so the question is, can we actually make them, plus AI, serve as the level of experts? And I've decided not to bore you with PowerPoint slides, but I can show you, for example, an amazing demo where you'd have a primary care practitioner who uses a program that's been trained on 1 million echocardiograms. So echocardiograms are the ultrasound of the heart, and to do an echocardiogram well, you don't have to go to medical school, so you don't have medical school debt. Just do it a couple of years of trade school, and you can create a great report, a great set of images, and the AI now can create the report like an expert cardiologist. So can they actually together do better? And I think there's a lot of challenges that we have to go through, but I think we have no choice actually at this point. Medicine is at a very critical juncture. And if we don't think about how can we use this safely in a clinical grade manner, we're missing, I think, a singular opportunity to deliver great care to us in ways that are unlikely to happen. And what's amazing, by the way, is many of these studies have shown already, and I find it not reassuring, is these AI programs are actually seem to patients more empathic than doctors. They spend more time than a hurried doctor. Multiple studies have already shown that the letters that are sent out are more complete and more empathic. So, what should we say? Let's see if this works. Hi, GPT-4. I'm sitting with an audience at Brookline High School. Could you please write or say out loud an ode to Brookline High School, highlighting, if you can, some of the great scientists that graduated from Brookline High School?
That's great to hear.
Okay. Sorry, I have a connection problem. Did you hear me, GPT-4? Hello, GPT-4, can you hear me? Oh well. So the last thing I want to say is the public and public health has a very important role in how these things are steered. One of the most important, and this sounds very technical, do I have 1 minute?
Yeah, but that's it.
There's something called steering or alignment. And these programs just behave in a certain, sometimes a very contentious way out of the box. And in order to avoid them telling you how to kill yourself or how to create a nerve gas, they have been aligned and told what are the things they can say or can't say. And so, for example, whether you like it or not, as my teenage boys found out, you can have it say a gangster rap in praise of President Biden, but it won't do it in praise of President Trump. But the same questions are in public health. What is going to constitute allowable and reasonable discussion? Because who is it serving? And going back to what John was saying, can we have a more nuanced public health discussion? It was decided that we would say we should give everybody the vaccination. But there could have been a more nuanced thing which says teenage boys don't have to have the vaccination. And the question is, could you have had? Sorry. Now she won't stop talking. And so the question is, do we want it to toe a public health line? Or do we want it to serve us individually and say, can you explore this hypothesis? Should my son, my 18-year-old son, get it? I'm immunized myself. From my perspective, should I get it? From the public's perspective, should I get it? And think of it now as an active participant, a new voice in the public health discussion. And how are we going to align it? I'll stop there.
Thank you, Zach. So I think you see the common theme already is both John and Zach kind of laser focused on how do we make sure that this new generative AI is optimized for the public good, and which is exactly up your alley. And last but very much not least, we have Raul Fernandez, who kind of represents the public good for us now. He is the executive director of the Brookline for racial. But what's the noun? Executive Director of Brookline for Racial Justice and Equity. And also I want to say has had the incredible courage to serve on the Brookline Select Board, which takes a certain Teflon skin. And I just want to thank you for that service as well, Raul.
That it takes courage to serve is something else. You ain't wrong. So this is wonderful. I really appreciated John, I thought your slides were not boring at all. I thought they were terrific. I thought they were wonderful. But Zach, also your remarks as well. I think were really insightful. For me, as someone, I just came from class. I'm an educator. I'm a faculty member over at Boston University, but in education. And I had to leave class early to be here. And I told my students I'm about to be on a panel on AI and public health. And they looked at me like I was crazy. And I said, yeah, I'm not expert in either of these things, but I get to be on a panel about it, which is fantastic. I do think a lot about the way that AI is used currently and could potentially be used in academic settings, educational environments, and classroom settings and the like. So I'm not completely foreign to the topic. But I was really thinking about that role, Carrie, of being an elected leader here in Brookline. I served under the iron fist of Heather Hamilton, actually, who's just in the back, who was our chair at the time. And Heather and I served during quite the time together. I was elected after having been in town meeting, was elected to the select board in 2019, May of 2019. And my first term ended at the beginning of a global pandemic. And we as elected leaders, particularly with the parameters that are set around public meetings in Brookline and notice and those kinds of things, and it made it very difficult for us to operate within those dynamics and make really moment by moment decisions about how to keep people in our community safe. And so I think a lot of our conversations, and rightfully so, because we're not always in emergency situations around the use of AI and other emerging technologies, are going to be around sort of long-standing problems. How do we get to the heart of those problems? How do we go upstream and figure out what the root causes of those issues are, the things that public health people do best? And also, we've got to think about what it looks like to have access to these technologies during crisis periods. During those moments when we may want to rely on technologies like artificial intelligence, but also when we may not be thinking with the clearest heads, when we may not have as much information in a very hot situation as we can take our time to gather in a cold situation, where elected leaders in particular, the vast majority of whom do not have public health degrees, are running oversight over issues that are very much related to the public health and community welfare. How do we use these emerging technologies to improve our decision making, but also how do we use them to interface with our real, true experts that we have in our community? I was thinking a lot about this. I'm not one that's, I come over here and tell this is horrible. What are you doing? This is talking about how great these technologies are, and they're rife with bias. And as my wife, who works a little bit in this space, would say, garbage in, garbage out, right? And so what you're getting from a ChatGPT is based on what folks are uploading into it. I'm not here to say that, though. I'm very much a fan of innovation. I think these are phenomenal tools. I supported the scooter pilot. I was really a fan of innovation there. Oh man, Heather, man, you tore this town apart, Heather. You remember those days? Scooters everywhere. Talk about public health concerns. Anyway, so I'm all for experimentation and engaging with these technologies, but I think it also behooves us as members of a community to recognize our own role in this. Our own responsibility to use these technologies in a very moral way, in a responsible way, in a way that thinks through the consequences of either sort of ceding our own judgment to that of the will of the AI gods, and also thinking through the kinds of questions we're asking. You could ask today, any of these programs, you could ask something like, what are the best ways to address, in parentheses, public health issue? You're going to get what you're going to get. But you could also ask, what does the peer review literature say about what works to address insert public health issues? You're going to get something different. But we've also got to think about who is included in peer-reviewed literature, in peer-reviewed studies, and who's not. It always comes down to, especially in questions like this, our community. And our community is, we all think our communities are special, but there are distinct characteristics to any given community. Aside for a second here, I remember I was asked by the president of our college to help develop a first-gen program, program for first-generation students at BU. We knew what it meant. He wanted to develop a center for first-gen students. And so we went to work on doing some research, as we do, before we just say, here's what a center would look like. When you look at the overall research around first-gen students, you find that on average, they are typically academically, oftentimes, behind non-first-gen students. They tend to struggle a bit more than non-first-gen students. But when we looked at Boston University students, what we find was there was no gap at all between academic outcomes for first-gen students and non-first-gen students. That was not the issue. The issue was around high-impact practices, things that enhance the experience like study abroad, undergraduate research, paid internships, and the like. And so we built a program around that, not around what we've seen or we've heard are the issues. We did our own community research, and that's what we still continue to need to do. This is why we need a public health department, not I mean, we can't sort of let AI handle all of these things. We need people who understand the local context, who've been here, folks like Sigal Reese, who's joined us in the last few years and brings a world of experience. But also, where's Wendy? Wendy back there, who's been with the department for I don't even know how long, as long as I've been around, who also live in the community and have lived here for some time and understand the unique context of Brookline, populations in Brookline. And then folks, like Bonnie and so many others who are also thinking about those underserved, underheard voices and populations and understand the unique challenges that they face as well. As a community, we come together and we solve these problems. And so really thinking about how we can use these tools to enhance what we already do, but not to supplant what we do, but really to enhance it. I think those are the things that I think we should be thinking about. So there you have it. Let's go AI. In a responsible manner.
Thank you, Raul. That's the most rousing speech about AI ever. Thank you. So we have a few minutes left for questions. You can direct them to the whole panel or to a specific person. I say from the bottom of my heart, no question is too basic. And in fact, if it seems basic, you're probably doing people a big favor because they're wondering the same thing. Yes.
So my name is Kaya Vanderzeel. I'm a retired physician, but I used to be a town meeting member as well. Sorry.
I couldn't hear that.
She was a town meeting member for a very long time.
And a retired physician.
I'm a retired physician, so this is totally a different kind of question than you might expect. What is the carbon footprint of AI? We don't hear much, but occasionally, about the carbon footprint of the internet, which for most people seems like, well, it's free. I mean, you sign up for a service, that's all you have to pay for, but what's the carbon footprint of all this? And the other thing is, I don't know, I don't have any trouble with the primary care physician, but maybe that's because I'm already established, and I'm so sorry to hear that nobody can find them.
It's a big, long wait. Yeah, Zach.
So the carbon footprint is huge. Right now, Microsoft is building, I think they told me, I may have it off by a factor of 2, but a new data center every week to cope with that. And they recognize that they have a real problem. And that's why it presents another set of issues. They have announced that they're investing heavily in a new generation of nuclear reactors because they recognize that the carbon footprint is going to be enormous if they continue to grow like this.
Yeah, it's a great question. We at the hospital, we have a number of sustainability initiatives, and most of those are focused on sort of the obvious things in terms of building and energy. But we actually now have a subgroup that is focused on sustainability when it comes to computing. So thinking about doing code reviews and thinking about how we leverage the internet and how we think about our processing and coming up ways to cut down on that energy spend, because as Zach said, I mean, there's huge amount of energy involved in both just general computing in our facilities, but now the access to AI, it is scaling enormously, and that has to be part of the conversation.
Questions? Comments?
Hi. Yeah, my question is regarding the social determinants of health and trying to see that you can use GPT-4 or some other AI platform to better interview patients coming in with multilingual processing, to be able to get that data into the medical records at your institutions, and then from there, try to correlate hopefully their health improvements if indeed the social determinants can be addressed. I mean, I think we face this problem in Brookline, trying to match what those social issues are to ultimately the health of our community. And so I wonder, Zach, especially speaking to Microsoft's CEOs, to try to be able to do something across the entire Boston region with the hospitals and the intake that you can do in your clinics there, to be able to correlate then, hopefully the SDOHs that you intake that way against what you're seeing in terms of the health status of our population, and then giving feedback to the local departments of health regarding the patients in those zip codes.
I love that question for many reasons. First of all, because, as you know, social determinants of health are sometimes dominant in terms of risk factors, outweighing genetic factors in many diseases. But the other reason I like it is because of what this guy said, which is the local environment is incredibly informative. And one of the big AI failures during COVID was an electronic health record company called Epic had a predictor of who was going to deteriorate. And so that you could allocate ventilators or ICU beds and so on. And there's a long story. I have my issues with it, like it was not peer reviewed, but so there's a whole other set of issues. But another group also had an Epic electronic health records system, just 2 states away, ran the same program, and it didn't work because their patient mix was different, their exposures were different, the practice of medicine was different. And then 6 months later, the original hospitals were deployed, switched off, because our COVID had changed and the way we treat COVID has changed. And by the way, medicine's always changing. And that's just a more acute example. And so I love your idea, because I even know companies that are actually thinking about that, which is instead of these boring sheets that patients fill out while waiting for the doctor, which doctors never read, to actually have an interview with GPT to actually get the disclosure, not just from your zip code, but from your actual life. You know, what's your living status? Is there a helper? To really understand what are the real constraints and to have that inserted into the medical record and made actionable. I think that's incredibly important. I would love, not for Microsoft, for Boston to decide they want to take that on. What a wonderful thing it would be for our city to be able to say, we care about social determinants, and we want in every health record in this city for that information to be shared. I think that would be wonderful.
John, did you want to add?
No, it's great.
Yeah, great question. Yeah.
We have 7.5 minutes left. I'd like the whole thing. All right. I'm in my 50th year of being a licensed doc, still an active license, although I'm retired, which means I'm not getting paid for anything. I've been thrilled to have so many tools to use to care for my patients. When they first started putting computers on our desks, then the next thing you know, I could track out somebody's blood pressure for 5 years, show them the screen, and show them what it looks like when they don't take their meds and when they change the meds when they take it. they trust me because of how I use the tools. A lot of docs now are worried that they're going to be replaced. Are we going to replace radiologists reading your MRI?
No.
Why the heck do you need a human being doing that? Primary care docs are going down. I've been a geriatrician and a home care specialist for 40 years.
We're losing those as well.
They're disappearing.
Absolutely, disappearing.
You say, holy Jesus.
Yeah.
We're in trouble. And I gotta say, some of the medical students that I trained in their first year out of residency were making more money than I did as a geriatrician for 40 years. So, you know, why don't we help people? People love to practice medicine. That's why they do it, I think, not for money. But if they need to get it, we have to encourage them to do primary care, and even geriatrics. Why don't we pay their damn medical, their student debts off and let them know when they're starting that if they wind up doing primary care in an underserved community for X years, they will have to pay nothing for their training. And trust me, I've seen students like this when they get out there doing home care visits with us at Boston City and Boston Medical, they say, wow, this is unlike anything I've ever had.
So I'm much more cynical than you, and my prediction is that if you paid their bills, they would still be getting in each other's way, trying to apply for those dermatology and plastic surgery programs, and contrast that to Israel, where they have a pure HMO system, and because they're at risk. In other words, if you get sick, the state has to pay for it. They pay primary care doctors more than their surgeons because they understand that preventive care is going to save the state money. We don't have that here, and therefore your wish, even if we paid their bills, we have to pay them $300,000 a year if we want primary care doctors.
Now, you stole one of my minutes, but I have to say, maybe I can't convince Harvard medical students to not go into dermatology and thoracic surgery, but the BU students, I think I can convince them, especially if they're from minority families themselves or immigrant families or whatnot. We can motivate them just by relieving them of that burden and showing them a really beautiful way to go. The last thing I've been working with professional medical interpreters since 1985. They're another profession that is worried that they're going to be replaced, and particularly since they're mostly immigrant women. They've been treated like
immigrant women.
Crap, I'll say. And still are not considered real professional members of our teams. And they're worried that an avatar with artificial intelligence speaking whatever language you click on will replace them. And I tell them, I work with them internationally and tell them, you know, you're just like us docs. There's something that you guys never mentioned. It's called the T word, trust. That I can be really smart and get the right answer. But if you're my patient, you ain't gonna do what I think you should do or what I want you to do unless you trust me. You have a feeling that I respect you, that I care about you. It's not just this, empathy. Oh, I really care about you. No, it's something nonverbal from below, down here, somewhere below the brain that is required. Building a trusting relationship with a primary care doctor, nurse practitioner, PA, even a dietitian or a physical therapist. Those people are worried that they can be replaced by avatars of AI. And I say, who the heck, I'll use that word, would trust an avatar telling you, okay, raise your shoulder like this, and then swing it like that. If it feels bad, just keep doing it. No. They're going to walk out of the room and ain't coming back to the clinic or to that.
You're making really, can I cut you off? Or?
I'm used to that and I'm done.
Okay. No, I think you're bringing up a very a point that comes up a lot, and it's about replacement of existing professionals. I think the way that we're couching it is that these are the tools are co-pilots. They're not meant to replace, but why not take advantage of the vast knowledge that these large language models are trained on to support your day-to-day tasks? We've implemented AI at Boston Children's to do something that probably, maybe you enjoyed the hours of documentation, but many clinicians would prefer not to do that. I don't know, so you can tell me. But we've implemented, with the collaboration with Microsoft and Nuance, ambient listening. So it captures the conversation between a patient and a provider and their families, structures that conversation, that audio file, and then turns that into text, which then is used to support writing the note. That is then reviewed by the clinician. It's not sent out in the wild, but is reviewed. Imagine the amount of time. We've done this now. We've generated AI notes about 60,000 times at Boston Children's, and the delight that people are getting from the delivery of care now, because they're not spending all their time typing onto the computer terminal. They're actually having a more natural engagement with
I was
patients.
told by a doctor at Brigham and Women's who used the system, she said it was the first time in 20 years that she looked at the patient the whole visit.
So you can see, these technologies are enabling, so you could look at it as taking away the practice. You can also say it as bring joy back in the practice of medicine as well. And so that's sort of how we're approaching it, is how do you take technology out of the engagement? How do you create efficiencies and have people work at the top of their license when they're working?
And I also want to remind you, what do we call the person who graduates at the bottom of their medical school class? Doctor.
Yes.
And so that's 50% of doctors who are probably below average. We want to make sure those people get assisted.
Yeah.
So on that note, and I would also add from the patient point of view, to be able to speak as long as I want with an AI doctor is also, and ask any questions I want at any level, is also somewhat appealing. But we won't go there for now. For now, I want to thank everyone who helped organize this, especially Lynn and everyone else who was involved, and most of all Chris, who is. And most of all our panelists, actually. I'm going to hand off the mic to Chris to bring it home.
So I like to do everything in threes. I have 3 kids, and I can only remember 3 things at a time. So I'm going to try to be quick. I learned in 2020, I think many of us did, how thankful I learned how thankful I am for so many things. And to this day, I often do it as well. Before I go to bed, despite what my husband wants to do, I will say, let's talk, and we each come up with 3 new things that we haven't been thankful for to say what we're thankful for, and you can't repeat anything. It's kind of annoying, but kind of, yeah. Try it tonight. Tell me how it goes. But you'll find that, you're really thankful. So one thing I'm going to share is I'm thankful that we had this moment in time together in this space. This is an amazing, oh my God, this is the first time I've been in this building. This is crazy. This is gorgeous, and it really shows that as a community, we see that education is a condition and a social determinant of health, and we put our money where our values are, so I'm thankful for that. The second thing is I'm very thankful for all of those who got awards and who are here and who collaborated and are part of making sure that Brookline is as healthy as it is, but also as big of a heart in a community as I know it has, and we're trying to get better with that, so thank you. Then the third thing I'm thankful for is, as I sat here, I was like, I can't believe there's like a free program with food and snacks and sparkling water, and I've got like these rock star panelist people being moderated by Carrie Goldberg. Like, where else but Brookline does this happen, right? Like, kind of nowhere else. That's pretty wild. So I'm thankful for all of that. So I share that with you when you go home. Please think about your 3 things. Maybe do it every night. And then finally, as I close out tonight, again, thank you to the Friends of the Brookline Public Health. And don't just say thank you. Let's show it by donating. It's the season of giving. Again, it really, I do feel good when I can donate, whether it's 5, 10, or if you have $10,000, we'll take that as well. Because it does feel good. But just know that no matter how much or how little, it is a meaningful amount to you, but it is a meaningful amount to the recipient. Whether it's someone who has clean water now in Kesilwaukee because of that, or it's a child who lives in Brookline public housing who now has food in their tummy so they can go to school. So know that when you give to the Friends of the Brookline Public Health, you're really giving to your neighbors and to those who you see and maybe don't see, but are in need. And And I ask you to please think about that, but don't just think about doing it now at the giving season, but all year, because our needs are all year. And my last thing is, the holidays come up, and I have 3 kids. I'm kind of freaking out about what to get them for Christmas, right? And no offense, but I don't think our Friends of Brookline Public Health donation is gonna cut it this year for them. So no, but in all seriousness, we have a number of children in Brookline public housing and throughout Brookline who are in need, who won't have Christmas presents this year unless we all help each other out. So Bonnie Bastian, who was here and received an award, is leading an effort. So I ask that you give money to the Friends of Brookline Public Health and also some money to the Brookline Community Development Corporation for their toy drive so that those 400 children have at least one gift to open that day. You can give money, or you can actually give a gift, which I think is so much fun. You can donate them at a number of our public schools, at all 3 branches of our Brookline Public Library, at our town hall. You can give to your local small business. Eureka Puzzles is a collection spot. And then Henry Bears, which is so fun. You can go in, you can buy something, get 15% off, and donate it there. That's a one-stop shop, right? You're doing good all around. But I ask that, again, 2 things, not 3, only 2 this time. Give to the Friends of Brookline Public Health and donate so that all 400 kids in our public housing will have something to open this holiday. Thank you. Good night.